Hello, this is Dr. Maria Azizian. Welcome back. Today we will be discussing food sensitivities and testing for food sensitivities. We will specifically feature a food sensitivity test by a company, Boston located company, KBMO. What is the difference between food sensitivities and food allergies? Food allergies are more straightforward, and usually most of us by a certain quite early age, usually, but not always, know our food allergies. For example, a very common food allergy such as allergy to peanuts, peanut butter, etc., peanut products, allergy to shrimp, lobster. So those are common food allergies, and usually they are known when we are children. And reaction is immediate. You can have immediate reaction of rash, including hives, and of course a bad reaction such as anaphylaxis, which means that you're essentially in a state of severe shock immediately upon the intake of a certain food. And that's a scary reaction, and that's why those types of people who have these severe reactions, they do carry EpiPen, and that's what really is the main function of EpiPen is for those life-threatening reactions. But of course, there are milder reactions, and they're still considered food allergies because they are usually immediate and they are very clear to pinpoint as to the cause of these allergies. In medical world, we would say that food allergies are propagated by IgE hypersensitivity. So those are immunoglobulins in our immune systems that are responsible for different hypersensitivity reactions. So IgE is associated with true allergies. However, here we're talking about food sensitivities. Food sensitivities could be extremely subtle. They may not be apparent at all, and they may start, for example, a day after you ate that food. You, for example, ate something in the evening and then wake up with a migraine. And the worst part about food sensitivity is that you may not be able to easily make a correlation between a certain food and between your symptoms. For example, how can you correlate a, let's say, brain fog and eating certain foods? It's actually a very subtle distinction because you may feel a little foggy all the time. You may feel, oh, a certain time of the day I feel a certain way, not understanding that this is the foods that you ate hours ago, and it may be exactly the same foods that are the culprit of this condition, and you keep eating them because you're not making the correlation. Of course, some of us are more sensitive than others, and we can say, oh, every time I eat this, I notice, for example, that my joints hurt. So, but that honestly is not the majority of us, and I think that it's extremely hard to know. There are several ways to go about this. How do I find out if I'm sensitive to a certain food? One way is to do an elimination diet. Elimination diet is a beautiful way of eliminating basically many food groups, and we have a separate video about elimination diet, but you eliminate many food groups and you end up with only very healthy foods for minimum of 2 weeks. It is recommended that elimination diet is done for 2 weeks, and then you start introducing other foods one at a time to understand what is your body reacting to. And that's a beautiful way to actually find out what are you reacting to. It takes more work, but it definitely is a very legitimate and it's a very biological way to find out, because your body is going to tell you what are you sensitive to. Sensitive to, not allergic to. So another way is to do your food sensitivities test. The beauty of food sensitivities test that it is more precise in the sense of that it will give you exactly the exact ingredient. For example, if you're eating a certain ingredient mixed with others and you say, all right, I eat this and then I have certain symptoms, but I don't know which ingredient. Let's say you're eating a salad and there's something in it that's causing a headache, because headache is actually one of the easiest symptoms to correlate with food sensitivities. Then you may ask yourself, well, which ingredient is causing it? And so in that sense, food sensitivities may be easier. Also, food sensitivities can show you in your profile over time, because one of the main questions that people ask me, can my food sensitivities change? Of course they can, because food sensitivities reflect immune composition in your body, and they're not as permanent as food allergies. So food sensitivities could change. However, here we come to a very important correlation between food sensitivities and gut inflammation. And there is a lot of literature on this fascinating topic, because it's like the chicken and the egg. Which one came first? Does the inflammation of our gut lead to food sensitivities, or do food sensitivities cause inflammation of the gut? And it's actually a dual relationship, which is they feed each other. So you can have inflammation that worsens your food sensitivities, and obviously offending foods will worsen the inflammation. So what is the relationship between food sensitivities and various medical conditions? I just mentioned a few of them, such as joint pain, migraines, headaches, but there are many of them. One of the sort of retrospectively obvious one, not in real time obvious one, is eczema, or for that matter, other skin rashes. Psoriasis could be propagated by food sensitivities, and that's when our skin speaks to us and points out that something is not right, something is happening. And usually in conventional medicine, we often say to the patient, oh, you need to moisturize more, and it's dry, or maybe it's winter. And of course, all of that is true, but the whole point of our approach, a functional medicine approach, is to go for the root cause of the problem. So what is really the root cause? Because all of us are subjected to a dry air or a winter climate. How come not everybody is developing eczema? Of course, genetics play a big role, but there are other factors. And those other factors, one of the big other factors, are the foods that we eat. So food sensitivities. So skin conditions definitely are very, very correlated with with food sensitivities. In fact, I've read a very interesting paper years ago, so I apologize, I can't quote the exact author, but it was fascinating, about this remote remote place in Pacific Islands where nobody had acne, because they had they had no processed foods. Everything that community ate was natural, so there was no acne. And I believe that. And again, I can't quote it. It almost seems anecdotal to me, but it's so it just makes sense. So, and very often people would say, well, I try to eat healthy, and then you talk to them, and really what the word healthy mean to different people is a different thing. So that's why for a functional medicine practitioner, it's very important to ask exactly what you're eating, not what you qualify as healthy, but what is a healthy eating to you as a patient. So, but I digress. What other conditions do we can be propagated by food sensitivities? There's a list of them that I actually made some notes here. Well, obviously diarrhea, constipation, GI condition, insomnia. Insomnia is a very big one. And this is another one that many intuitive people can guess. Sometimes people say, well, I ate this and then I didn't sleep the whole night. And that's usually your body knows. And that is true. So I tend to believe I believe the patient. I believe what they say. And then, of course, we look and then we verify that. But it's very important to listen to the patient's report. For example, I eat certain food at night, and I ate mashed potatoes at night. You really shouldn't, but and I couldn't sleep. So itching is very common. Itching is one of the symptoms that people truly suffer from. It's so undermined, and people kind of like swat it away and don't talk much about it. But a whole body itching without a rash, it's what keeps many people awake. So they develop actually insomnia due to itching. And you see it more, of course, in older patients starting a certain age, probably let's say 65, 70. However, it's not limited to older patients only, and it's true marker of something imbalanced in the body, and often it is due to food sensitivities. So not always, of course. And finding the cause of itching, just if you're just looking at the whole health, could be very difficult. So food sensitivities, it's sort of a window into looking. I would look at that first. Food sensitivities and gut health, I would look first as a cause of itching when I have a patient with an itching problem. Other conditions, arthritis, and any kind of joint pains, discomfort. And another big one is water retention. Water retention is important in terms of our ability to lose weight, because often we try to lose weight and we think that we do everything right, and maybe we do. Maybe we're following a certain diet that we got off the I don't know, magazine or some diet book, but that diet doesn't work for us. Why? Because our body has a sensitivity to certain food in that diet. And what happens very often, because there are different mechanisms for that, very often our body then takes that water, that extracellular water, and holds on to it. So, and that manifests in more weight. We do have then more swelling, more water retention, and most of it is visible, of course, but some of it could be just dispersed throughout your whole body. So you're holding on to that extracellular water, and that also either makes you not be able to lose weight or actually sometimes causes you to gain weight. And that's closely related to inflammation of the body. So now again, we come to the same point, that food sensitivity and inflammation, where are we? So they're both like this, because they're both intertwined in their causal and cause and effect relationship. One of the big food sensitivity repercussions or result of food sensitivity is a mood disorder, including depression and anxiety, or just labile moods. They are closely related to our food intake. And why is that? Well, serotonin, and that neurotransmitter, I'm sure, is familiar to most of you, because the antidepressants are based on mechanism of serotonin, on the uptake of the serotonin. And guess what is the largest organ that secretes and has serotonin in its lining? I guess I'm giving that away. It is a gastrointestinal tract. Our GI tract, our gut, has 90% of serotonin. So if something goes wrong, if we are having these food sensitivities that are correlated with inflammation, of course that would affect our mood. It will affect our disposition, our ability to be happy or not happy when we wake up. So the reach of the effects of our food sensitivities is so vast that a lot of it we don't know, and we honestly may never find out what is the cause of this without having it tested, without doing elimination diet. With my patients, I do recommend actually to do both. I think that both gives us information that can used together, and that would result in ultimately effective patient treatment. So, and I know that for some people, elimination diet could be quite daunting and scary, but I've done it several times, and I thought that it would be very hard. I can say that it wasn't that bad, and That's my personal experience, but I also see in many of our patients that once you do it, and 2 weeks is a good time. You can do it for 3, and some people do it for longer, but we don't recommend prolonged elimination diet because it could be somewhat restrictive. Well, it is restrictive. And so just doing this elimination diet for 2 weeks, I think, is a beautiful thing. It's good for your body. It's actually a mechanism of detoxification by itself, but it's also it's also helpful in the information. So as to the medical or a scientific component of food sensitivity, so they are propagated through IgG and IgA antibodies. And again, they could be measured. Before I go into the foods that we measure in KBMO test, that's the test that we feature today in our discussion, I have to say a couple of words about food intolerance. Food intolerance is different from food sensitivities. Food intolerance, for example, is alcohol intolerance or lactose intolerance. That's not immunologic, so that goes through different mechanisms. So this test does not test food intolerances, and most of the reactions from food, they are immune related. So most of them do go through those mechanisms of IgG and IgA antibodies that are being tested. And those are hypersensitivity reaction. That's how it is labeled in immune literature. So in terms of the foods that are being tested, there are various groups, such as I will go over them. Dairy, of course, including cow's milk, goat's milk, and of course egg yolk, whey, casein, grains. And grains, there are I think probably 15 or so: wheat, gluten, whole wheat, rice, spelt, buckwheat, barley. Fruits, there's a huge list of fruits. I actually found out myself that I was sensitive to pineapple, which I never knew. So it was very interesting for me, as you know, it's a road of self-discovery, so very interesting. So, and then from fruits we go to additives. That's a very good section because it includes MSG, it includes common dyes such as red dye number 3, number 40, it includes aspartame and stevia. I actually personally thought that I was sensitive to stevia, but I discovered that I was not, so it was interesting, another interesting little tidbit. And vegetables, again, a huge list of vegetables, and moving to microbes. This is a big one because it includes candida and baker's yeast, brewer's yeast. Those are very important, and actually I have quite a, I would say, large cohort of patients who are sensitive to that. And that's an important component because it is present in our bread. So aside from the issue of gluten, which is very important, but this is kind of right on the money when bread is not really, unfortunately, beneficial as much as we all love it. Beans, next group is spices. That's a very good group. It includes lots of spices, including cumin, garlic, ginger, mustard, paprika. Then fish, a bunch of fish, anchovy, salmon, trout, tuna, etc. Meats, all kind of meats. Extracts and miscellaneous, and that includes honey, coconut oil, mushroom, vinegar, red wine, agave, etc. Seeds, that's a good chia seed, because lots of people are into chia seed, and of course it's a good ingredient. Unless you're sensitive to it, then no. And shellfish, including oysters, squid, and many others. And finally nuts, and then there's a comprehensive list of nuts. So so that's a good list, actually, that includes a variety of food groups, so that's very helpful, and that's basically is your roadmap. With this test, you also get a food plan, which is very helpful. You don't need to follow that food plan to a T. However, in the beginning, it's not a bad idea because it's a map. It just gives you, these are your recommendation, and then you can add your own food plan. But I like this test report that comes in, because it does include a food plan, and food plan is always a good idea. It actually even helps you in terms of planning ahead what you're going to eat. Another component of this testing, and in general of food sensitivities, as I was alluding to earlier, is testing for inflammation of the gut. And we do have a comprehensive test for gut health, and actually there are multiple comprehensive tests that include lots of things. However, in the context of the food sensitivities, I'm very happy that KBMO offers a test for a leaky gut. It measures zonulin and occludin. Zonulin and occludin actually are markers of leaky gut, and they are related to tight junctions, which are junctions in between the cells of the gut. And if you have positive zonulin and occludin, then that is in red, because that's a negative thing, because that indicates some degree of leaky gut. So these components, these proteins are measured as part of this test. And additionally, that test measures candida, and also it measures LPS, that is often a marker of leaky gut as well. And you may think that because it's measuring components of leaky gut, or biomarkers of leaky gut, that it involves a stool testing. Actually, this whole test is a blood spot test, and that's very, very convenient, because the less you do to obtain the test, the easier it is. The more straightforward, the easier it is. And having said that, we do have many tests that are complex. You have to, for example, obtain the first urine in the morning, saliva, and blood spot for some other test. But for this specific test, thankfully, it's basically just a finger stick. It's a blood spot, and it gives you an information about 176 food groups, the food groups that I listed, and you can look at more of them on our website, iLabMD.com, and also, it offers these markers for leaky gut. These are very important markers because they open your eyes into condition of your gut. And if those markers are very off and elevated, and you see lots of things going on, then yes, I would recommend that we obtain and we do a more comprehensive gut testing on the patient. If only one marker is positive, we can work with it and just start working on foods first. However, if there are so many markers are off, then this person needs a little bit more help. And how do you deal with food sensitivities? The way you deal with food sensitivities, we can talk about it for a long time. But in a nutshell, first is to eliminate the foods that are inflammatory to you. That's a no-brainer. However, it's not easy to do. We're all creatures of habit. And to eliminate the food that we love, and very often we do love the food that we have sensitivity to. We just didn't know it, but paradoxically, that's how our bodies are made. So we are very attached to the very foods that are not good for us. And then we find out that we also have a food sensitivity to it. So unfortunately, so that's the hardest part, but that food needs to be eliminated. And I've learned that the best thing to eliminate something, to eliminate a food or a bad habit, is to replace it with something good. Replace it with something that's useful, that's healthy and helpful for you and your body. So in our sessions with our patients, we try to do that. We try not to just eliminate something that they love, but try to come up with a good alternative that would be taking a place of something that patient is very used to. So eliminating the food is the first thing. Of course, bringing probiotics is very important. Probiotics, they're such an amazing, it's an amazing chapter in our gut health, and probably deserves a separate talk. So, and in addition to probiotics, of course, other supplements. And that depends on a person whether they need specific supplements to address that. And sometimes more testing is required before just dispensing the supplements or recommending the supplements, because you need to make sure that those supplements will do something, that they are helpful. And in a leaky gut, they play a huge role, because if somebody has a very advanced leaky gut, it's not an immediate fix. It's a journey, as we say. It is a journey because it took a long time to get to this leaky gut, and now this has to be remedied. So we all want to have a good life in all parts of our body, be it our skin, be it our good night's sleep, be it our resilience and ability to exercise without joint pains, and of course our mood, being happy, being full of life and vitality. That's really is the goal. So that's the goal of any functional medicine testing, is really to restore. But again, food sensitivities is a huge topic, so I'm going to stop now, and until next time, thank you very much for listening. Bye-bye.